Good evening all. In tonight's video, I would like to offer you an overview and some toning exercises for cranial nerve 11, also known as spinal accessory. And the reason I wanted to move on to the next cranial nerve instead of focusing a lot more time on polyvagal theory, safe and sound protocol, and everything related to the functioning of cranial nerve 10, the vagus, is because a spinal accessory nerve is also very crucial as far as its role in social engagement. There are actually 5 cranial nerves that are responsible for us to switch to a state of rest and digest, to switch our autonomic nervous system into optimally functioning state where we can be socially engaged. I will probably create a short offering information on which cranial nerves are part of social engagement. So I will most likely make another video or two about cranial nerve 11, which I'm gonna start talking about in this video. So spinal accessory is a motor nerve, and it arises from spinal cord and exits the skull through jugular foramen. Then it descends through posterior triangle of the neck to innervate the trapezius and sternocleidomastoid muscles. At this point, you might want to review the diagram where you can see where the nerve exits and what it innervates. You could go to the post section on this channel or find a diagram online, the one that you like better. This nerve, cranial nerve 11, or spinal accessory, it is both cranial and spinal nerve. And there is a debate that still rages regarding whether cranial part is a part of SAN or part of the vagus nerve. It connects with the vagus at the level of jugular foramen, where cranial portion of accessory nerve originating from nucleus ambiguus in the medulla in the brainstem joins the vagus nerve and becomes functionally part of it, contributing motor fibers to muscles of the pharynx and larynx, as well as soft palate that are primarily innervated by the vagus nerve. Spinal portion controls the movement of the neck and shoulder muscles by innervating trapezius muscle that elevates, depresses, and rotates the scapula, as well as sternocleidomastoid muscle that rotates and flexes the neck. And I've mentioned that briefly in the beginning of the video, what muscles it innervates. So yes, it's just the two muscles, but they're so important that if this muscle here and this muscle here gets tight, the whole posture shifts, and over time it greatly affects the curvature of the whole spine and the muscles, and can actually have quite a bit of unwanted effects for musculoskeletal system and internal organs. That is why I wanted to make an additional video or two about spinal accessory and ways to help alleviate some of the issues that might arise from improper functioning of this nerve and the muscle it innervates. So to tone the spinal accessory, we can perform exercises that target trapezius and sternocleidomastoid, and some of them you can find online, but the most basic is head rotation, and you could like tilt your head to one side and look up to see the ceiling or the sky with one eye, and then you could return to the midline. Then you do the same for the other side, and you roll up your eyes upward again. You could also do shoulder shrugs, just shrugging shoulder and holding, tensing, then releasing. You could do as many as is comfortable for you. Always choose the exercises that are okay for your body. If you have any medical conditions and or other conditions that would make it unsafe, please, just be safe and or consult your healthcare provider of what it is that you can safely do. So physical therapy exercises are sometimes prescribed with focus on the shoulder girdle and neck mobility. And if you are currently in physical therapy and you're experiencing some issues with these muscles, you might want to address it with your therapist, and or you could look up some of the exercises that are offered. But always start with gentle ones and gradually increase in intensity and resistance. That's just a general recommendation. Also, it is advisable to engage in proprioceptive training, and I will talk about proprioception in some later videos perhaps, or you can look it up. And it's spelled proprioceptive, proprioceptive training. That one incorporates exercises that focus on body awareness and muscle control to further optimize movement in this region specifically. Upper chest, neck. So this is what I have for you today, and like I said, I will be returning to talking about spinal accessory in further videos. Thank you for listening. Hope you find this material helpful. Have a good evening.